Well, good afternoon, everyone. Let me just thank everybody for being with us today for our COVID-19 weekly briefing. Got a big crowd for you today that you're going to hear from. We've got Dr. Kathleen Toomey, Director Homer Bryson from GEMA, General Tom Carden, Georgia National Guard, Colonel Val, Department of Public Safety, State Patrol, Commissioner Mark Williams with Department of Natural Resources, and wrap us up today, we've got our Agriculture Commissioner, Gary Black. For several months, our nation, as you know, has been fighting an invisible enemy and uniting to ensure the health and well-being of all Americans. The path has been long and difficult, and everyone is making sacrifices to keep one another out of harm's way as we fight to stop the spread of coronavirus in communities all across the United States. Medical providers, public health officials, frontline workers, first responders, law enforcement, they're all working very long hours and spending significant time away from their families to help limit potential exposure. These brave men and women are literally saving lives every day. It is impossible to thank them enough for what they've done for us, but I know that countless Georgians join my family and I in praying for them daily. As you all know, this weekend is a powerful one for all Americans. For years, we have taken this moment to reflect on the sacrifice made by those in uniform. We honor these American heroes who answered the call of duty and paid the ultimate price for our freedom. Earlier today, I was honored to attend a Memorial Day ceremony with the Georgia National Guard to honor the lives of retired Master Sergeant Mark Christopher Allen and many other American heroes. Master Sergeant Allen's family, fellow service members, and many others were in attendance as we took some time to remember those that we have lost and acknowledge our many blessings as Georgians and Americans. This year, Memorial Day will be even more powerful as we find inspiration from our fallen soldiers. We need their encouragement and commitment now more than ever. While this battle against COVID-19 is far from over, I remain encouraged by the data and the feedback from public health officials. As you know, testing remains a top priority as we take measured steps forward. In addition to rapidly increasing testing capacity, we have also seen a steady decline in the percentage of patients testing positive for COVID-19. This is a key data point and a real testament to the hardworking Georgians everywhere who are following the guidance, wearing masks, and practicing social distancing. While inconvenient at times, these proactive measures are truly paying off. I'm proud of what we accomplished over the last several weeks, but we cannot rest on our laurels. We need to further expand access to testing, and we need to encourage Georgians to make it a priority. This morning, we were proud to announce that CVS Health is opening 23 new drive-through testing sites across Georgia. Now, more Georgians and more communities will have access to convenient and quick COVID-19 testing options. I want to thank CVS President and CEO Larry Merlo and his team for their commitment and strong partnership in our state. I'm also excited to see that several Georgia companies have partnered with Augusta University to help accomplish their mission in the fight against COVID-19. Our friends at SK Innovation recently joined numerous businesses and organizations in financially backing AU's efforts. And earlier today, Augusta University announced a partnership with ShareCare, the state's official wellness vendor. Through the Wellbeing Georgia website, ShareCare will help members of the state health benefit plan access vital tools and resources to keep their families safe and sound. This website drives traffic to the AU Health Express Care app for free virtual COVID-19 screenings, 24 hours a day, 7 days a week, with no appointment and no cost required. Again, we are so grateful for these types of partnerships that are helping us move the needle in this fight. Speaking of making progress, we reached another milestone this week. As of today, we have less than 1,000 COVID-19 patients hospitalized in our state. GEMA's 1 p.m. update has that number at 919 patients. This is a 38% drop since May the 1st. I want to especially thank our hospitals, large and small, for working with us over the last several months to enhance surge capacity. And as always, I want to thank the frontline workers for helping to nurse these patients back to health. As a reminder, Georgia's health systems are ready to serve patients for elective procedures and routine appointments. I want to strongly encourage everyone to get important checkups on their calendar. In the past few days, we've seen reports that some of our largest, most successful hospital systems are having to, believe it or not, furlough staff in the midst of a pandemic. Please go to your doctor for a checkup if you are due for one. Schedule time for routine procedures like dental cleanings and eye exams and other tests that can prioritize your health. One of the most aggressive actions taken to the battle in the spread of COVID-19 in Georgia has been the disinfection efforts undertaken by the Georgia National Guard in our long-term care facilities, including nursing homes, assisted living facilities, and personal care homes. The Georgia Healthcare Association, the Georgia National Guard, and GEMA have been discussing best options to continue these efforts to protect our senior citizens and others that are in these facilities. Working together, they had developed a plan that I have approved to continue the disinfection efforts in all 790 senior living facilities across our state. This strategy has a three-pronged approach. First, the Georgia National Guard has produced and will be providing an instructional video on how to safely and properly disinfect these facilities. Additionally, GEMA has purchased and will distribute industrial foggers, disinfectant solution, and appropriate PPE to 353 nursing homes. And we anticipate that those supplies will be delivered within the next 4 weeks. Our PPE shipments will mirror a recent 7-day supply of PPE that we received from FEMA to nursing homes as part of their Operation Commitment to Care. I certainly want to thank President Trump, Vice President Pence, and the task force for supporting this recommendation, and certainly to Director Gaynor and FEMA as well for their support. In total, Georgia will be sending approximately 14,000 face shields, 161,000 masks, 749,000 gloves, and 35,300 gowns to our nursing homes. Finally, we have worked with these facilities to ensure that they incorporate disinfection efforts into their regular cleaning schedules and follow the appropriate guidelines. Across the nation, the 2020 census is underway to ensure an accurate count of the population every 10 years. This effort plays a vital role in allocating representation among states and funding large-scale projects like infrastructure, health, and education. The amount of federal funding that we receive for these projects depends on our state's population and participation. And right now, Georgia's response rate is 55.8%. That is lagging 3.8% behind the national rate. I want to ask all Georgians, if you have not responded yet, visit my2020census.gov or call 1-800-330-2020 to respond. Before I turn the podium over to Dr. Toomey, I want to take just a moment to address a recent data reporting concern involving the Georgia Department of Public Health's website. I have said from the very beginning that we are making decisions based on data, science, and the advice of public health officials like Dr. Toomey. We are committed to full transparency and honesty as we weather this healthcare crisis. Georgia families, businesses, local leaders, and the press deserve accurate data, and I know that Dr. Toomey's team is working around the clock to collect, sort, and produce that information. We are truly blessed to have one of the best public health directors in the nation leading our state through this pandemic, and her team is working around the clock to ensure the health and well-being of all Georgians. They are taking massive amounts of data from countless sources, putting them into accessible format under a global spotlight, all at breakneck speed. Please afford them some patience, and please steer clear of personal attacks. We are all in this fight together. This Memorial Day, I want to encourage and wish everyone to have a good, safe weekend following the public health guidelines that is working here in our state. And with that, I'll turn it over to Dr. Toomey, and she will make some remarks. Dr. Toomey?
Oh, thank you, Governor, and good afternoon. I wanted to just briefly mention again what the Governor said. The integrity of our data is absolutely our #1 priority. As this pandemic has evolved, data continue to evolve just as the technology continues to evolve around testing and being able to identify who has the virus. You know, we have to have transparency. We are continuing to work to improve all of our reporting systems. That is what is going to give us the ability to respond adequately. So I want to just once again say that having multiple, actionable, accurate data is our top priority for public health, and to make that available to the public, to decision makers, to the media, and we will continue to do that as we move forward, and hopefully with even greater agility and greater ability to provide the information you need in a timely way. The department also is continuing to make great strides on our contact tracing program. We actually gave it a new name. It's called the Healthy Georgia Collaborative, and I think that's really reflective of the fact that this is not just a COVID virus prevention effort, but in fact a collaboration, a partnership, something that's going to require community engagement to be effective. We have discussed several times before that effective contact tracing is absolutely essential for us to stopping the virus now at this stage of the pandemic. And we're working with a lot of community partners, some that we've worked with for other health conditions. We're working with the faith leadership, we're working with local hospitals, but we're also working with the business community and many new partners and community-based organizations to gain the support from the community to be able to do this work. You know, to be able to do this, we have to have people respond to us, to be able to answer our calls, to be able to feel comfortable giving us this information. And so gaining that trust of the public is essential, and that engagement with the partners will allow us to do that. Since the redevelopment and kind of redeployment of our contact tracing efforts, we have conducted case interviews with more than 3,300 patients and have worked with those cases to identify nearly 9,000 contacts. We have on board already 500 contact tracers, and by Monday, we plan to have, we will have onboarded 500 contact tracers by Monday. And by mid-June, so less than a month from now, we will have that full 1,000 that we had predicted we would. Several people have commented, will that be enough? We were using an estimate based on a Johns Hopkins estimate of 7 contact tracers per 100,000 population, and that came out to roughly 1,000 people. But we have the agility that if we find that we need additional people, particularly as we move forward, we can hire more because we have so much interest in these positions. And I think one of the most important things to say that it is the cooperation of the community that will make this effective, not how many people we have on board, or not the app that we have deployed that will allow us to enhance our contact tracing efforts. I also wanted to once again call out the CDC Foundation, because they have been so absolutely helpful to us, not only in identifying individuals, high-level individuals for us to deploy, including a logistics coordinator and a training coordinator for all of our statewide contact tracers, but also additional epidemiologists as well as additional contact tracers. It's these kind of partnerships with the donor community and others that will allow us to be even more effective in the future. Our contact tracers will be reaching out, will be calling. Please encourage everyone to be cooperative, because this will be the key to our successful in this effort. I lastly wanted to mention the remdesivir. We talked about that last time we met. We were able to get this out to hospitals very, very effectively. Of the first shipment, we sent to 8 hospitals across the state, provided treatment for 110 patients. I had several hospitals call me over the weekend thanking me because they already had patients that they were treating with us, and we're grateful to have that. Today's shipment went out to 29 additional hospitals, and that will give us the capacity to treat 310 patients around the state. And we just found out that we have an additional shipment coming in. This is remdesivir in a powdered form, so that it actually has more flexibility and can be transported more easily, so we can target with this effort not only rural hospitals, it's also can be easily used for pediatric patients. And so we're going to focus also on making sure we have a sufficient supply for our hospitals that treat high-risk pediatric patients as well. And last, I just wanted to comment that the public health has worked in partnership with GEMA on many hurricanes in the past. This is probably the most challenging hurricane Director Bryson and I have ever worked on, and I hope we'll ever work on again. And I just wanted to acknowledge his partnership and support throughout this. And so thank you, Director Bryson, for your help.
Thank you, Dr. Toomey, and good afternoon. GEMA Homeland Security continues to work with our vendors, state partners, private partners, and volunteer organizations to provide the necessary resources for Georgia's response to the COVID pandemic. A major piece of the resource is acquiring and distributing personal protective equipment and ventilators. We continue to see wide availability of ventilators throughout the state. Today, Georgia facilities have 2,822 ventilators on hand, and out of that, 1,981 available. On average, we're only seeing 30% of the ventilators available in our state in use daily. Medical facilities and nursing homes request resources through the Department of Public Health Ready Op system, and local governments and critical infrastructure partners request resources through the GEMA Web EOC portal. To date, the state has processed more than 16,432 resource requests. To put those numbers in perspective, during Hurricane Michael, GEMA processed 1,051 resource requests. Approximately 12,262 of the resource requests have been for PPE, and more than 12,000 of those have been completed. To date, more than 2,700 entities across the state of Georgia has received PPE from the state. As part of completing these requests, Georgia has pushed out approximately 3.3 million N95 masks, 7.82 million surgical masks, 341,000 gowns, 10.92 million gloves, 338,000 Tyvek coveralls, 886,000 face shields. To keep Georgia moving forward, GEMA is fulfilling requests from critical infrastructure essential workers. and has delivered over 600,000 cloth masks to the transportation, energy, telecommunications, water, wastewater, and food processing sectors across the state. We are also supporting the Department of Administrative Services in their efforts to safely reopen state government. As part of the reopening process, we have ordered 210,000 cloth masks, 1 million surgical masks, 153,000 gloves, and 16 million wipes. We are working with the Georgia Building Authority and Georgia Correctional Industries to purchase, package, and deliver approximately 2,500 gallons of disinfectant weekly. Additionally, I'd like to say thanks to Exxon for a generous donation. They provided us with 5,940 gallons of hand sanitizer, which we currently have in our warehouse. Making all of this happen has required incredible effort on the part of all of our employees and state partners. And I wanted to take a moment to acknowledge the countless hours that have been spent working to keep the citizens of Georgia safe. Our agency remains focused, and we will never forget that what we are doing each day directly affects the lives of every citizen. I'm going to switch gears for a minute. Dr. Toomey started this. Hurricane season is fast approaching, and for the 6th year in a row, the Atlantic saw a preseason tropical event. Georgia's coast and our southwest region know all too well how devastating these storms can be. Our goals remain the same as they have been in years past. GEMA wants all citizens to pay attention to the progression of these storms and heed the guidance of officials if you find yourself in harm's way. For information on how to prepare, you can visit the Ready Georgia tab on our website at gema.ga.gov. And it's my pleasure to introduce General Cardin.
Thank you, Director Bryson. Good afternoon, everyone. As Governor Kemp has already mentioned, your National Guard has been pretty busy over the last few weeks at his direction and in support of Director Toomey and Director Bryson. We've completed 1,700 infection control missions in one of Georgia's long-term care facilities. Within those facilities, we visited 774 of those facilities on multiple occasions to safeguard some of Georgia's most vulnerable citizens. In addition to that mission set, we're currently active in 6 hospitals around the state, and we're supporting Dr. Toomey in her efforts to ramp up testing. We've been doing that since the 17th of April, since we began that mission support. We've collected more than 40,000 samples for COVID-19, and we very much appreciate the partnership with both GEMA and Dr. Toomey in that effort. We've also been very active in the food security arena. Just this week, we finished our support of the Fulton County school system, where the men and women in the Georgia National Guard ensured the delivery of more than 948,000 school meals to the children in Fulton County, and very much appreciate the honor to do that for them. In addition, we're supporting more than 10 food banks around the state. As such, the men and women of the Georgia Army, Air National Guard, and the State Defense Force has supported the movement of more than 41 million pounds of food to people in need and more than 21.6 million meals being prepared. So again, very proud and honored to serve our citizens in that regard. What I've told our people since we started this mission is we are what our results say we are. And obviously I'm very proud of the men and women and the results that we've produced for the citizens of Georgia. In context, in addition to everything else that the Georgia National Guard has done over the last 60 days, in the last 3 weeks, we've deployed 2 Army National Guard units and 1 Air National Guard unit to fight the enemies of the United States of America. Couldn't be more proud to lead your National Guard. Thank you. I'll be followed by Colonel Powell.
Good afternoon, everyone. The 2020 Memorial Day holiday season officially begins tomorrow at 6 p.m. and runs through Monday, May 22nd at midnight. It expires. The Memorial Day weekend will be like no other than we've had before. Even in these unprecedented times, it is the job of the Georgia Department of Public Safety, as well as our law enforcement partners across the state to emphasize the safety responsibilities of everyone on Georgia's roadways, waterways, beaches this upcoming weekend. Memorial Day weekend is one of the busiest travel periods during the year due to graduation celebrations, special holiday events, vacation travelers who will add to the regular weekend traffic. Last year, during the holiday period, troopers investigated 430 traffic crashes, resulting in 247 injuries and 13 deaths. Law enforcement officers across the state would agree with me when I say, even one life lost on Georgia highways is too many. Last year, troopers and motor carrier compliance officers issued 10,000 citations and arrested 384 impaired drivers. These are some of the simple things that everyone can do to lower these statistics. Make sure every occupant in your vehicle is buckled. Children under the age of 8 years are properly restrained in appropriate child safety seats. Remember, Georgia is a hands-free state. Put down your telephone and pay attention to the road. Obey the posted speed limit and avoid being an impaired driver by planning a designated driver or the use of a ride share or taxi during your weekend festivities. As motorists and visitors make their way around the state and to the coast to enjoy places like St. Simons, Jekyll Island, and Tybee Islands, they should expect to see troopers of the Georgia State Patrol, officers of the Motor Carrier Compliance Division out in full force. In addition to keeping the roadways safe, the beaches will be saturated with troopers and officers ensuring everyone is compliant with the governor's order on social distancing. We will be looking out for large gatherings, the rules of the beaches, and making sure business restaurant owners are following the guidelines set forth in the order. In addition to what is expected of troopers and officers, much is expected of the citizens, business, restaurant owners, and visitors to our state of Georgia. The Department of Public Safety expects everyone to adhere to the executive order issued by Governor Kemp. While it is our mandate to enforce violations of the order, it should never be necessary. Business and restaurant owners are expected to keep patrons in compliance with the order indoors and outdoors on their businesses. Visitors to the beaches are expected to follow the rules and guidelines outlined by the Department of Natural Resource Commissioner, Mark Williams, and those traveling on our roadways are expected to obey the travel laws. I want everyone to enjoy this holiday, have a safe holiday weekend, and I want everyone to practice social distancing and abide by the governor's order. Thank you very much and have a good weekend. At this time, I'll call on Commissioner Mark Williams, Department of Natural Resources.
Good afternoon, everyone. I'm Mark Williams, Commissioner of the Department of Natural Resources. Thank you all for taking the time to hear from us today. I want to thank Governor Kemp for his great support and for having me join him here to share the work of DNR. In lead up to Memorial Day weekend, DNR is hard at work implementing safety procedures and personnel strategies to make sure Georgians and visitors to our state are able to safely enjoy our natural resources during the COVID-19 response. Memorial Day weekend is considered a traditional start of the busy season for boating, along with our state parks and beaches. With this in mind, it's very important that those taking the state's natural resources follow all public safety guidelines, including social distancing, and that those on our waterways strictly adhere to boating safety regulations. For social distancing, the current guidance is that groups be limited to 10 or fewer people, and they should remain 6 feet apart at all times. Should anyone observe groups not adhering to social distancing orders on our waterways, beaches, state parks, or other properties, please report such incidents to DNR Law Enforcement Division by calling our Ranger hotline at 1-800-241-4113. Again, 1-800-241-4113. For those planning to enjoy our waterways, it is critically important to follow provided safety guidelines. Please remember these safety tips, just to name a few. Always wear a Coast Guard approved life jacket when boating and fishing. Children under the age of 13 are required by law to wear a life jacket while on a moving boat. Do not boat while under the influence of alcohol or drugs. Lastly, always swim with a buddy, never swim alone, and parents and guardians, don't take your eyes off small children while they are swimming. To help enforce these safety protocols, our law enforcement division will have 85% of its statewide workforce on our state waterways and beaches to address boating violations, emphasizing boating under the influence enforcement, and monitoring for any violations of the governor's COVID-19 directives. As Georgians look to enjoy our great outdoors, our state park day use areas, golf courses, cottages, and campgrounds are open. But our playgrounds, splash pads, and swimming pools will remain closed. All sites are following strict cleaning and sanitation protocols, including the CDC's guidance for administrators in parks and recreational facilities. Should a site reach admission capacity or if social distancing is not possible at a certain point, our park staff can and will temporarily suspend day use admission until enough guests exit the property to reopen. Game wardens will be at our state parks and will have an increased presence at our heavily used parks such as Sweetwater Creek, Cloudland Canyon, Red Top Mountain, and Tallulah Gorge, to name a few. In closing, I want to thank every DNR employee for their hard work and commitment to keeping Georgia and its citizens safe every day. DNR is fully devoted to serving our great state during this complex time, and we will fully utilize our available resources until the job is done. Thank you again for having me this afternoon, and at this time, I will turn things over to Commissioner Gary Black.
Governor, First Lady, good to see you today. Thank you, ladies and gentlemen, for the privilege of being here. I'd like to begin today with to recognize three groups in particular that have been important in our operation, and as we've all been dealing with this challenge and dealing with it together. First, I'd call your attention to a little thing in my hand. The 4-H pledge says something like this: I pledge my head to clearer thinking, my heart to greater loyalty, my hands to larger service, and my health to better living. 4-H'er from Sylvester, Georgia, Worth County, Janiah Green, made sure that my health was for better living throughout this event, and I appreciate her so much. So this is, everybody, there's a great message for young people, not just in 4-H, but to other leadership activities across the state. And my message to them would be, as we talk to adults, let's talk to young people too. Young people, it's time to be careful. It's time to follow the rules too. But I appreciate Janiah helping my health to be better during these times. Secondly, to my colleagues to the right, we've had a chance to work together in unprecedented times, whether Dr. Toomey and Sheriff Owl, as we were dealing with our Colonel, as we were dealing with challenges in some of our harvest operations and doing testing, and a remarkable response in that regard, and helping those rural communities. And certainly with Director Bryson, our long-term partnership and different types of supply chain activities that we've been doing. But I tell you, a real hero, and Mark Williams, our partnership with DNR has never been closer than it is today, but a hero of the state of Georgia is General Tom Carden and his team at the National Guard deserve all our thanks, all our praise. We've worked very closely together to make sure that food operations stay open, and make sure that our protein processing plants are operating properly, that we have the proper equipment, and certainly testing at some parts of this adventure. So General Carden, my salute goes to you, sir, and to the entire Corps that we have, we're so blessed with here at the Georgia National Guard. Thirdly, I'd like to thank some heroes in my world. First, we want to thank those producers, those farmers, those great Georgia-grown farm families who are producing for you and I every day. But with there's a behind-the-curtain group of folks that need recognition, and those are the heroes that I get to work with every day at the Georgia Department of Agriculture. Particularly within our laboratories, we've not missed a beat during this entire challenge. We've processed, we've analyzed, and our technicians, our scientists have processed more seed than ever before. We're back to certifying shipments for export. We've made sure that those businesses have stayed open. We're dealing with challenges all throughout this. We all want Georgia-grown vegetables. I want to speak to that in just a moment, but we want that now more than ever. But for our over 2,000 inspections during this spring that put 250 million vegetable transplants into the marketplace, all throughout this time of challenge, farmers wouldn't have been prepared for the 2020 season, but they are. And there's some heroes out there that I have a chance to work with every day, and I'm grateful for you. And we'll keep working together to get through this together. The whole issue with our farm family right now is one of a terrific challenge. They began this season seeing what was happening in Florida, seeing that crops were destroyed, dairy products were destroyed. We were fortunate to have a 3 or 4 week window to begin doing some things proactively to try to address that and make sure it didn't happen here. But ladies and gentlemen, as many of us, we've had many opportunities to speak with the media in the last few weeks. There's a certainty that when we lost food service, we lost school nutrition, we lost half of our market. So how do we replace that? How do we respond? And I'm so glad to have some positive news to share with you today with respect to the response of our marketing team. Georgia Grown is alive and well. Georgia Grown, matter of fact, I would suggest to you is needed now more than ever. You're going to see hashtag now more than ever. You're going to see hashtag Buy Georgia Grown now more than ever. And we already had those efforts planned, but then COVID-19 hit. So how do we respond to the producers and their needs, and how do we pivot just a bit in the marketplace and get directly to the consumer? Because see, I think we'd all agree that we have the finest farm families, the Georgia-grown farm families, the finest farm production unit in this entire country. We produce the finest products. Our Georgia-grown produce and fresh vegetables are the finest in this land. And those 10 million Georgians here are, I suggest, the finest consumers. How do we pull them all together? How do we do it in a unique way and do it quickly so we can address the needs of both the consumers and our production families all across this state? Georgia Grown to Go was birthed, and actually birthed in a terrific way yesterday. I invite you to go to GeorgiaGrownToGo.com and see what we have planned for in and around suburban Atlanta. But yesterday, wonderful efforts with State Representative Casey Carpenter and Dalton. Ladies and gentlemen, 13,500 produce boxes from the farms of the state of Georgia were able to go direct consumer purchase in Northwest Georgia. And shout out to my friend Representative Casey Carpenter for his heroic work up there. Now I'll tell you, I was up there for about 6 hours yesterday. I felt this morning that I touched 5,000 of those boxes, but we were able to get them all in a wonderfully organized event. That's going to continue this weekend. Tomorrow, I will be with the CAB CEO, Mike Thurman. Georgia Grown To Go is coming to DeKalb tomorrow. We know there are vulnerable families. We want to address their needs, and Mike Thurman has provided excellent leadership in this, and we're glad to partner with him. 100% Georgia Grown products coming to his citizens and our friends there. I look forward to serving alongside Mr. Thurman tomorrow. Cobb County is Saturday. Georgia Grown To Go in Cobb County is Saturday. We start in the morning, go until, and ladies and gentlemen, I can report to you today, just in 2 days of being in the market, over $100,000 in sales just in 48 hours. Pre-orders, produce boxes of great Georgia products from all over the state. We're going to be excited to be gathering at Al Bishop Park starting Saturday morning. But I hope that all of you out there would like to come, but if we don't get to you right now, Sandy Springs is underway, trying to work on some dates there. But Georgia Grown To Go comes to Gwinnett on May 27th, next Wednesday. It'll be from 3:30 until, and we'll be at Coolray Field there. So local leaders are joining together with our Georgia farm families, and then we're facilitating these activities, and it's going to be great for all of us. And so we're glad that we can play this very important part of linking consumers and our producers together during this critical time. There are others, ladies and gentlemen, please follow. We might probably have some viewers out there who would like to say, how could I purchase direct? How? Because that's a frequent question I'm getting these days. Okay, I'm a consumer. What can I do? The first thing you do is go to GeorgiaGrown.com. You can go to GeorgiaGrown2Go.com too to find about the events. But at GeorgiaGrown.com, there are over 250 of our Georgia businesses, farms, processors, manufacturers, food manufacturers that have product available online, and I hope that many of our viewers will be willing to do this as we wrap up this event. But we're here to stay all throughout this growing season and into the fall. The great partnerships that are being built, and we as a Department of Agriculture are going to be here to serve both farms and the consumers of this state. God bless you this Memorial Day weekend. Thank you.
Well, thank you, Commissioner. And let me just take a moment before we get with the questions just to thank this whole team and many other people that aren't here today that have been serving our state during these unprecedented times. I think Georgians can be proud of the efforts that many of us, some that you've seen through these press conferences, and hundreds or thousands that you have not, that have literally been working 24/7. We're grateful for all of your service and all that you're doing to help us respond to COVID-19 and the pandemic, but also to work like Commissioner Black is doing to help our farm families from an economic disaster, but also get those products to people that really need them and people that want to support them here. So I'm grateful for that, as well as I am for the support from Marty and our girls during this time as well, and many other people that are literally behind the camera. So with that, we'll open it up for questions.
Governor, this question is either for you or Dr. Toomey or both, but what specific steps is the state taking to ensure that public health data is accurate and transparent after repeated missteps in reporting the coronavirus figures over the last few weeks?
Yeah, and I'll let Dr. Toomey speak to that. First of all, I just want people to know they can be confident in the data, but also, look, we're not perfect. We've made mistakes. When we do that, we'll own that, change it, and make sure that people are aware of that. I spoke to that earlier in my remarks, and Dr. Toomey can speak to that here in just a second as well. But I also think it's important for people to know that, I'm not following one data point. It's been kind of interesting as we've moved through the pandemic and the response and what people have been focused on here and there, what other states are doing, what we've been doing. But just know that every day I'm looking at a lot of different data points that we're getting. We talk about a lot of those every day. There's some things that I see that, we don't necessarily talk about a lot. There's a lot of minutia involved in that, but it's very helpful for me to be able to follow those data points. So I think people can be very confident in the decisions that we're making are based on more than just one thing, and I'll let Dr. Toomey speak to that.
Thank you.
No, thank you. Actually, thank you for the question because I think it's an important one. You know, public health data are not a simple process. As the governor stated, the data come from many, many different sources. And this is a novel virus. If you remember, we first reported the first case March 2nd. And here we are just a few months later with thousands of cases. So this is an unprecedented ask of any surveillance system to ramp up this quickly, plus make the accommodations for the new technology because new tests become available. And as the serologic tests are available, they now are being collected in addition to the PCR and other direct current COVID infection tests. And so there's a lot of things happening as well as the new syndromes. We have 9 cases right now in our state of the new pediatric Kawasaki-like syndrome. That's something we had to start reporting just now because it was never recognized before. So I guess what I'm trying to say is this is an unprecedented ask of health surveillance to be this agile and be able to expand this quickly. We're working diligently. We have a very competent team of skilled, largely CDC-trained epidemiologists working on the data, meeting many times daily, going over these data. About a month ago, you noticed a change in the way the website looked, and we got the assistance of some SAS programmers to make it look a little more professional and updated. We are working more closely with them to ensure that the graphics that get up there and the graphs that are displayed are consistent with the way we as epidemiologists look at the data. And we are meeting with them literally daily to ensure that that's going on. So that's new and will be continuing. So I think we recognize that this is important. This is an unprecedented ask for any public health system, but at the same time, this is a time when we need the public's trust, and we won't have the public's trust unless we can assure them that these data are accurate, timely, and do represent what's going on in the community. And we have a strong commitment throughout not only our department, but the districts that are working with us and all the many reporters throughout the state. We do take in data from many, many different sources, not just our own public health testing, but private physicians, hospitals. And so we have to amalgamate that and make sure that it's consistent. And sometimes there are things that aren't quite right. Someone noticed that Fulton today lost a couple of cases. Well, it turned out that it appeared that wherever that patient was reported actually lived somewhere else, but was tested in a hospital in Fulton. And so that change will be made within the data system. And so when you're looking at that, what does that mean? That they made a mistake? It wasn't a mistake. This is the way public health data are. They have to be constantly updated, constantly reflect the new information we take in every day. And as we begin to more aggressively do our contact tracing, and as we interview our cases and get even additional information, we'll be updating those cases even more, so we even have more information to have our surveillance system be even more accurate. So that's a long-winded way of saying there's a lot that goes into public health surveillance that probably doesn't meet the eye.
Quick follow-up, is it fair to say then that you've implemented new accuracy checks to make sure there's no misstatements?
That and more feedback, more information, more within our agency, more communication, and more effort to ensure that these data don't just meet our needs as epidemiologists, but are presented in a way that the public can use. Data are only useful if whoever's looking at it can understand and get the implication of what we're trying to say. It's not useful if only I, as a trained epidemiologist, can use it. And so I think that's part of the other thing, is trying to ensure that there's some simplicity. But a website or data here or there should not be the holy grail. I mean, that should not be the only thing we look for. It's just one piece, it's just one tool that we use. You know, those interviews that we're doing with the patients, the interviews we're doing with contacts, all the work we're doing and outreach in the community, those community efforts, all this put together will help us better address what we're doing. So, thank you.
Good afternoon, Governor. Jonathan O'Brien, WGUR in radio in Milledgeville. My question is another data question. In nearby Hancock County, there is a nursing home facility, Sparta Health and Rehabilitation. It's by no means the only facility which is doing this, but it's the one that I want to cite to you today. It was on the front page of the AJC. In that facility, there have now been 17 deaths at last check from the Department of Community Health's data release. There are 52 residents who have been COVID-19 positive and 20 staff who are COVID positive. I spoke with the spokesman from the North Central Health District, and he told me that agencies aren't sharing data. The Department of Community Health isn't sharing that data directly with the Department of Health, and in the article from the AJC, it said that they do not have access to the other agencies' data. Since data is so important in this response, why aren't agencies sharing data? And an additional question with regards to that, what can the state do to compel nursing homes to report that data accurately and in a timely manner to all agencies? Dr. Toomey, if you could also.
Yeah, and I'll let Dr. Toomey speak specifically to the situation in Hancock County. We've had many discussions about that. Obviously here recently, I know General Cardin's team has been down there and spoke with Commissioner Berry at Department of Community Health about that today, and we may have to get some more information for him to fully follow up with your question. But I can assure you our focus, as I have said for over a month now, and certainly as we have seen our trends move in the right direction and our curve get flattened and our all these different metrics that we're using starting to go in the right direction, headed downward, our focus continues to remain on the nursing homes. I spoke in long-term care facilities. Director Bryson, General Cardin, and I all spoke at length about that earlier today at this press conference with our remarks about how we're going to continue to do the infectious disease control cleanings, how we have been training not only nursing home staff, but many, many other industries across the state to help them do a better job in this, the delivery of PPE supplies that FEMA, the Trump administration, and the federal government are sending, what we're going to be sending, so we know we need to continue to focus there. There is no doubt in my mind that we are doing everything that we can in a really tough situation. We've seen throughout the country this COVID-19 virus is deadly for medically fragile and elderly people, which is why we continue to have the shelter-in-place order in effect for those individuals, especially the medically fragile and those that are in our long-term care facilities. I have asked Dr. Toomey repeatedly, as well as General Cardin, are there other things that we need to be doing? And I believe that we're doing everything that we can now, but we also need other partners in the private sector that own these homes, and the general public's help as well. This is just a tough situation that as you look around the country, I mean, half of our fatalities in Georgia, just about, are from these facilities. Thankfully, our numbers aren't near as high as others, but we are not celebrating that. As Colonel Val said, one life lost is one too many. But with that, I'll let Dr. Toomey speak to any specifics about Hancock County.
Well, thank you. I want to specifically address two things. One is, I think there's never been more communication and coordination between the Department of Community Health and Public Health than there is now. We share data daily. And so there is a lot of information going back and forth, and we actually have a list. And if they know of cases that we don't know, we take action on that. But in that particular facility, right now, today, I have a team of epidemiologists, specially trained in infection control, going down there, meeting with the staff and also the administrators to ensure that we identify any issues that are going on so that we can continue to mitigate this. And as I've said many times before, and the governor's remarks reflect that, is that we can test and we can disinfect a facility, but unless they continue with good infection control practices, we're going to continue having these problems. And I see that as an ongoing role for our public health teams, who may do spot testing when they go in later, but also will continue doing this reinforcing infection control in partnership with Department of Community Health. And so there is a good deal of partnership and data sharing about this and other facilities as well.
Governor Kemp, who ultimately decides what data is or is not included on the website? And also, in the effort of transparency, are you guys committed to making sure that these errors and mistakes that do happen are unveiled or released before they're called out by the media or somebody else?
Well, I certainly am. You know, I've told people for months we want to be transparent. I have been. I'll let Dr. Toomey speak specifically. There's a whole team of people that are really, I think, deciding the data. We've added things as we've gone along. But I would just tell people to remember back to when we were reporting this data one time a day, we were getting pressured from people that we need more real-time information. We need to report, you know, every minute or 3 times a day or 2 times a day, and we started doing that to try to get the information out as quick as we can. And I think by doing that, sometimes the information, and I'll let Dr. Toomey speak to this because I'm not over there with her team at Public Health every day, but sometimes, you know, they may not be having the time that they need to check on these things. I've asked them to look at those procedures to see if there's something different we should do, perhaps like Colorado, who's taking and reporting a day later. So they're getting all their data today. They're not going to report it real time. They're going to report it this time tomorrow to give them more time. And I would imagine if we had done that over a month ago, we'd have got heavily criticized to do that. But right now, my goal is to make sure we continue to be transparent and we have the right data up there. And if we don't, you know, we're going to own that and we're going to tell people what happened, and then we're going to get it fixed and we're going to keep moving on. You know, this is something that public health officials, you know, that are working in today's world, they haven't been through a pandemic like this, and they certainly haven't been through something like this where you have the real-time data apparatus that we have today. That is not what Dr. Toomey's team that's not what they're best at. You know, they're epidemiologists, they're public health officials, and that's what they do every day. I mean, until this pandemic, they haven't really had to deal with a massive dump, which she just talked about, of data on these issues. And we've been sending some people over to help her with that. We'll continue to do that, and if she needs more, all she's got to do is ask us, and we'll continue to do that. Dr. Toomey.
One of the things that we've talked about is a public health surveillance system or data system like this is, which is monitoring trends in disease, are never real time, because you're already, there's a delay in that test getting back, there's a delay in that report getting reported to us. For deaths, there's a delay in getting that death certificate. And things like Twitter or Facebook can be real time, because that may be posted by somebody as soon as they hear about their test result, but we don't hear that test result until later. Or they may post that they're feeling sick and they think they have it, but we may not get that information until weeks later. And so, in fact, our data are never actually real time. And I think, as the governor pointed out, that taking a little more time to be able to ensure that there aren't those duplications, because sometimes people may be reported by a laboratory and be reported by their doctor and be reported by a health department, getting those duplications and unduplicating data and making those corrections will make those data more accurate. But these systems are but I think we're never designed to be looking, you know, an hour-to-hour basis and to see. That's not the trends that we look at. But we look at it kind of big picture and where are we going. And we also generate hotspot analyses once or twice a week, and that has been very useful to identify areas that light up, particularly now that we're doing so much more testing with public health, going out to pop-up sites throughout the state where there hadn't been testing available before, as well as in nursing homes throughout the state, along with General Cardin. And then where we see these areas of increased positive test results, we can quickly go in and do contact tracing and quickly go in and try to understand what's going on in the community. And I have to say, for example, in Gainesville, that it was actually not our surveillance system that told us about what was going on with that increased transmission, but actually the community and the hospital themselves reported to us before our surveillance system was even sensitive enough to pick up on that. And that's why I say these data are not the only piece that trigger action on public health's part and the part of all of us together as a team. It needs to be a much more comprehensive approach. And I think no data system, whether it be measles or Legionella or this, were designed to be looked at with this scrutiny. I actually am grateful that the media are looking at this closely, because often you can recognize things that I did not see, or there are some inconsistencies that I didn't notice. And so it's not that we're trying to hide things, and there's no deception there. There may be a simple explanation that has to do with how the data were collected, or some of the other issues around where those data were reported. And I hope that helps explain, at least in part.
Hi, Governor. Andy Parati with 11 Alive News. As you're aware, Georgia Supreme Court Justice Keith Blackwell is going to be retiring soon. You do have the ability to appoint a new justice. Do you believe Georgians should be electing their next Georgia Supreme Court Justice?
Well, first of all, you'll have to talk to Justice Blackwell about why he resigned. And, it's my duty as governor. I took an oath to follow the law of the state of Georgia, and that's exactly what I'm going to want to do. I know the legislature's weighed in on that issue for many times over the years about how that process works, and that's the process that I'm going to follow.
Hey, Governor Kemp, Hope Ford with 11 Alive. We know that there have been issues with absentee ballots, some voters having to vote again, and some mailers being sent out with the wrong date of the primary. So how is the state handling those issues, and also advising counties to handle those issues?
Well, as you're aware, we have a constitutional officer, Brad Raffensperger, who's the Secretary of State, that's administering elections in the state, along with the county elections officials that actually hold the elections. So I would refer that question to them. I have been focused on a pandemic.
Thank you.